Hello everyone. Today, we're delving into the world of a medication called oxytocin, commonly known by its brand name, Pitocin. As always, this discussion is for educational purposes only. If you have health-related questions or concerns, please seek guidance from a medical professional. Description: Oxytocin, often recognized by its brand name Pitocin, is a synthetic hormone medication. Its primary function is to stimulate uterine contractions and promote the ejection of milk from the mammary glands. Oxytocin is naturally produced in the hypothalamus and released by the pituitary gland during various physiological processes, such as labor and breastfeeding. In the medical field, oxytocin is primarily used to induce or augment labor in pregnant individuals or to control postpartum bleeding. It plays a crucial role in facilitating childbirth by increasing the frequency and strength of uterine contractions. Additionally, oxytocin is employed to manage incomplete or inevitable abortion and to help with the expulsion of the placenta after childbirth. This medication can also be used to initiate or enhance lactation in nursing mothers, as it aids in the letdown reflex, allowing milk to flow from the breast. Warnings: before the administration of oxytocin, certain precautions should be taken into consideration. It is crucial to inform your healthcare provider if you have any allergies or sensitivities to oxytocin or similar medications. Additionally, it's important to discuss your medical history, including any previous uterine surgery, cervical surgery, or other conditions that might affect your response to oxytocin. Oxytocin should only be administered under close medical supervision in a hospital or clinical setting, as it requires careful monitoring of uterine contractions, fetal heart rate, and maternal vital signs during labor induction or augmentation. Before using this medication, it's essential to discuss its potential risks and benefits with your healthcare provider, especially if you have any underlying health conditions or are taking other medications. Side effects: like all medications, oxytocin can have side effects. Some individuals may experience uterine hyperstimulation, which can lead to excessive contractions and reduced oxygen supply to the fetus. Other potential side effects may include nausea, vomiting, abdominal pain, headache, and changes in blood pressure. It's crucial to be aware of these potential side effects and promptly inform your healthcare provider if you experience any unusual symptoms or discomfort during the administration of oxytocin. Interactions: oxytocin may interact with other medications or medical procedures. It is essential to inform your healthcare provider about any other medications, supplements, or herbal products you are taking, as well as any prior uterine surgeries or conditions, to avoid adverse interactions. Dosage: the correct dosage of oxytocin is vital for safe and effective use. The dosage and administration of oxytocin will be determined by your healthcare provider, based on your specific medical condition and the purpose of its use. Oxytocin is typically administered intravenously, and is carefully titrated to achieve the desired uterine contractions during labor or postpartum management. Dosage and infusion rates will vary depending on individual needs and response. Avoid: while receiving oxytocin, it's important to follow your healthcare provider's recommendations and guidelines for labor induction or postpartum management. Be sure to stay well hydrated and follow any instructions for changes in body position during administration. As with any medication, it is advisable to avoid alcohol and inform your healthcare provider of any medications or substances you may have consumed. FAQ: people often inquire about the safety of oxytocin during pregnancy. Oxytocin is commonly used during labor to induce or augment contractions and is considered safe when administered by trained healthcare professionals in a controlled medical setting. However, its use during pregnancy should always be carefully evaluated and monitored by a healthcare provider to ensure the well-being of both the mother and the baby. Closing: that concludes our overview of oxytocin, commonly known as Pitocin. Remember, this information serves as educational guidance and should not replace professional medical advice. If you have any questions or concerns about oxytocin or its use, please consult with a healthcare provider. Thank you for tuning in.